How are you? Today next lecture, topic F2029. It is a lecture about schizophrenia. Title, Schizophrenia, Acute Transient Psychotic Disorder and Persistent Delusion Disorder. It is, if you remember the previous lecture, ICD-10 2029, or in short, we said F2 or 2029. Main features of the chapter of the 2029, main features. Etiology, prevalence endogenic factors. If you remember, F2 and F3 influence endogenic factors. Usually we find in the hereditary the patients with these disorders, or maybe not these disorders, but with mental disorders and other disorders in the among members of the family, grandfather, grandmother, and so on, cousins, and so on, maybe. Prevalence endogenic factors, then psychotic level of disturbances, I repeat and repeat, usually presence of next severe symptoms, it is hallucinations, delusions, excitations, non-adequate behavior, very severity level of mental disorders and disturbances, it is psychotic level. Then criteria exception, we must accept organic disease, we must exclude drug abuse, because previous was lectures, 2 lectures about F0, organic symptomatic disorders. We must exclude organic disease and drug abuse. If we find organic disease, for example, head trauma, drug abuse, and appear psychotic symptoms, we can say, for example, if had trauma in anamnesis, we can write organic delusional disorders. Here we must exclude any organic pathology. Then we must exclude information that this man used different drugs during especially last time. Next, organic stigmatization is absent due to the physical examination. So we must confirm that absence of organic stigmatization, absent any pathology in the MRI, electroencephalography, absence liquid hypertension, absence different convulsive waves on the electroencephalography. For example. Тут вот это выскакивает, закрою, да? Просто закрою. Так, next slide. Structure. There are schizophrenia in this topic 2029, schizophrenia. Usually we will talk about this disorder, very severe disorder, then acute transient psychotic disorder, persistent delusional disorder, and schizoaffective disorder. It is structure. Please remember the structure of this topic. Schizophrenia, general characteristics. Schizophrenia, it is chronic mental disorder with usual progressive development. То есть you know, maybe many students know without studying psychiatry, many people know. For example, when relative address to us, first question, it is schizophrenia or no schizophrenia? То есть many people, a lot of people understand that schizophrenia is very, very serious, chronic and very serious and very, very negative mental disease, and all people afraid before this disease. Schizophrenia is prevalent in all cultures and religions. Nearest 1% of population is suffering in every population with this schizophrenia. And usually men have onset of schizophrenia between 15-25 years, maybe later, but usually it is a lot of cases, and women between 25-35 years, maybe later, but a lot of cases we observe in this age diapason, for example. Schizophrenia, etiology. Etiology is currently unknown till now. Many years, maybe centuries, we study many psychiatrists from start of the previous century, 20th century, studied this disorder, but cannot find one, for example, etiological factor which explain polymorphism, the clinical picture of this disorder. Why in some people arise this disorder, in other people don't arise. There are many theories which explain of arising schizophrenia. No, for example, first theories, it is group of biological theory which explain arising of schizophrenia, influence of different factors. For example, genetic factors which foundate results on the investigation, the blinds, because among blinds we registrate more high level of arising this disorder. If one member from blind is have symptoms of schizophrenia, usually second blind to start have these symptoms by time. No, it is one of the method, but in some blinds maybe the situation's absent. Next, neurochemical theories about different level of transmitters. Immune dysfunction, for example, there are some investigator try to explain by immune dysfunction. Genetic factors, for example, new investigation explained by genes, some genes in the people, in some people which bring the gene of schizophrenia. Next group, it is psychosocial factors. Schizophrenia, it is crucial defects, is disturbances in ego organizations. According to learning theories, children who later have schizophrenia learn irrational reactions and ways of thinking by imitating parents who have their own significant problems. But it is theories not confirming during time, because many children have many problems, very severe problems, but stay healthy, mentally healthy stay. So these psychosocial factors not explain appearing not all symptoms of schizophrenia. Due to the ICD-10, there are some symptoms usually necessary. For example, due to ICD-10, it is necessary to find one clear sign or two not clear sign from first group symptoms, and two symptoms from next group of symptoms from 5 to the 9. Now, for example, first group, you see on this slide, first group from 1 to the 4, it is first group of the symptoms. Of the main symptoms of the schizophrenia, on the first place, you see echo symptoms, echo thoughts. The patients feel that other people read his thoughts, or maybe opposite situation when these patients understand and read the ideas, the thoughts of another people. It is echo thoughts, or sometimes you can find information, open thoughts, or syndrome of open thoughts. in the different maybe books, literature, you find this information. When patients, for example, are isolated home because he is afraid before another people, because they in the street read their thoughts of these patients. Echo thoughts. Second main symptoms, it is being delusion. Usually it is delusion of influence or action, usually observed at the schizophrenia. In this delusion, the patient feels the influence of external forces. It usually influence on the ideas, thoughts, on the senses, and on the moves. Usually they feel this influence by brain, by body, by sensitivity. They maybe due to the sensations, and usually say about this influence. Maybe combination of this all influence on the thoughts, on the senses, emotions, on the moves. Maybe only ideas, for example, only on the thoughts and so on. For example, one example yesterday was one young man. He talking with us, but in this time he listens the maybe voices of another person, and they influence on his thoughts. Stop talk, not talking, not conversate with doctors, and so on. And sometimes he talking with us, sometimes he by gestures, by mimics, we understood that he listened them that another thoughts. Next, verbal voices and other forms of hallucinations. Usually, what is this example of voices when person listen in the head and other voices of another people, of maybe from outside, maybe different voices. The voices may be imperative voices when they influence on the behavior of this person. For example, they imperate him to kill something, to stand up, go there, go here, and so on. Don't eat with members of family. It is imperative hallucinations, for example, and usually predominant verbal or auditory hallucinations. Next, strong delusional ideas about another delusional ideas, for example, extrasensory possibilities, the delusion of lead the country. One patient was in the department, she has very good mood and considers he is a future president of one country. But had not critical attitude, because how he will be president if you every year admitted in the hospital, for example. Extrasensory possibilities when patients consider and sure he has extrasensory possibilities and can treat another people from different diseases. It is first group of, if clinical picture we observe first symptom, very clear first symptom, echo thoughts, we can write schizophrenia. Second group. It is from 5 to the 9. It is other forms of hallucinations, maybe visual, olfactory, tactile hallucinations, maybe visceral hallucinations. Visceral hallucinations when person sure that one object is in his abdomen, stomach. For example, when patient was admitted in the psychiatric hospital, in the department, and when we observed him, he was very anxious, aggressive, because he was sure that he has in the abdomen 2 snakes, and palpate the snake, and demonstrate and ask us to touch his abdomen, because there are 2 snakes, and was excited because why the ambulance admitted him to the psychiatric department, not surgical department. He was very excited because he crying and ask us, ask the around people, ask the doctors, nurses to call and admitted to the surgical department, Next thought, it is what hallucination, visceral hallucination. Some person, for example, patient considers that he has in the brain, not snake, he has another animal, I forgot, this animal in the brain, they felt some object in the brain. It's very, very severe, very bad feelings. Next, thought blocking, thought insertion, to is different formal disorders of thinking. You remember formal disorders of thinking, for example, hampered thought blocking, neologismus, incoherent, very, very specific for schizophrenia. Next, catatonic disorders. Catatonic disorders may be expectation, negativism, mutism, stupor, catatonic stupor, for example, when person stay in one pose a long time due to the muscle tension. Next, negative senses. Negative senses. It is inadequate emotional reactions, poor speech, social separation, decrease of social productive activity. It must not be the depression and the result of pharmacotherapy. We must exclude it. То есть, firstly, the relatives complain that these patients become stay at home, decrease interest, not contact with friends, and so on. The productivity is decreased, lose job, lose education, and so on. It is negative senses. And change of behavior. I repeat, lack of interest in activity, social autisms. There are some clinical types due to the ICD-10. There are some types. In short, I explain what the types of schizophrenia may be. Not maybe, we observe that the person with schizophrenia. It is paranoid schizophrenia, gibophrenic, catatonic, simple, mixed, and residual. No, usually you must know first three groups. For example, clinical type, paranoid forms. Usually paranoid form starts late in life, maybe after 25, after 30 years. Persecutory delusions and auditory hallucination are prominent. То есть in this paranoid form, the predominant hallucinations and delusions. Delusions usually of actions, influence, maybe delusions of meaning, high origin, maybe olfactory, taste hallucinations, and visual. The development may be periodically with general or not remission, it may be chronic. То есть this depends from forms of this paranoid schizophrenia. Prognosis is better than other types. It is, we observe a lot of among all forms of clinical forms of schizophrenia, the paranoid form is predominant. Gibophrenic schizophrenia. Gibophrenic schizophrenia usually touch the emotions, changes, mannerism, grimacing. We observe usually. Here we not observe hallucinations and delusions. Usually personality is disorganized and usually start the first symptoms at the age between 15 and 25 years. То есть very, very early age, and prognosis is bad, very bad prognosis, because these young men or girls decrease effects, vicious, and we see the clinical picture of schizophrenic defect. Catatonic schizophrenia, catatonic form. Catatonic schizophrenia, usually this type is becoming uncommon gradually. There are many psychomotor disorders or symptoms. You remember it is stupor, stupor, mutism, excitation, maybe grimacing, echolalia. You understand, echolalia imitates the examiner speech. For example, if I ask him, what's your name? He answers, what's your name, for example. Echopraxia, it is imitates the examiner action. Stereotype, it is repetitive behavior, то есть when patients repeat different actions, for example. Manierism, odd, different movements, active or passive negativism, and vaxive flexibility. Simple schizophrenia. Simple schizophrenia, it is seldom formed with graduate progressive development, usually started the children teenage period, usually in the teenage period, and usually relative considered is pubertic stages, puberty crisis, because in the puberty crisis, usually teenage lose interest, have many problems, behavioral problems, and usually parents consider that it is crisis, but really maybe simple schizophrenia. Residual or chronic schizophrenia, it is affective flattening, lack of initiative, poverty of speech, and so on. То есть that is form when schizophrenic was episodes, severe episodes of hallucinations and delusions, and after that we see clinical picture of residual chronic schizophrenia with negative symptoms. Good prognostic factors. Good prognostic factors, it is if schizophrenia has acute onset, presence of precipitating factors, late age of onset, for example, 25, 30 years, absence of family history, то есть hereditary is clean, prominent affective symptoms, affective depression or manic, for example, absence of negative symptoms, то есть that is person keeps the interest, maybe keep the education, again go to the institute, go to the job, for example. History of good premorbid, you remember what is it premorbid, good social and family environment, if family support these patients and participate in his life, for example, early initiation of treatment, and above average intelligence. Negative signs of schizophrenia, negative signs, it is gradually onset, early age of onset, for example, in the childhood or teenage period, it is very bad, negative signs. If you remember, gabaphrenic, catatonic, schizophrenia starts in the teenage period, it is formation defect more earlier. Presence of family history, it is supreme for some relative is suffering with mental disorders, it is negative signs. Prominent negative symptoms, you know what is it negative. History of change premorbids, for example, strange behavior in the premorbid, autism, non-adequate actions, for example, loose interest and so on, and bad social and family environment. No, when family not support these patients. Differential diagnosis you must do with chronic use of drug abuse, stimulant, for example, identical maybe clinical picture, thyroid dysfunction, maybe cerebral tumors, temporal lobe epilepsy, we can see the clinical picture of hallucinations or delusions maybe. Organic brain disorder, organic, for example, delusion disorder, and I say again that you must exclude organic stigmatization, drug abuse, so on, and bipolar affective disorders. Next topic, acute and transient psychotic disorder, acute and transient. For example, the brief prolonged psychotic disorders, arising acute with following recurrent, accompanied with delusion and hallucinations. То есть clinical picture may be identical schizophrenia it is if schizophrenia prolongation, it is very chronic disease. The acute, due to the title, it is a sudden not sudden in 1 minute, during hours, during 2 weeks arise. It is brief transient psychotic disorders, present delusion, hallucinations, but sometimes can transfer chronic form. General features, acute start during 2 weeks, representing clinic typical symptoms, hallucination, delusion, excitation, non-adequate behavior. Connection maybe with stress factors, connection maybe. We can find stress factors, we can not find. It is different cases. Acute start or onset correlates with good results. Typical signs, the clinic pictures change quickly as polymorphic, то есть now one hallucination, then another hallucination, then one thoughts, another thoughts, то есть polymorphic clinical picture. Presenting signs of hallucination, different delusions. Patient becomes healthy usually during 2-3 months, maybe during 1 month. And these conditions characterize absence with organic factors, dementia, delirium, trauma, drug abuse, and others. То есть we must exclude all organic stigmatizations, we must exclude dementia, we must exclude schizophrenia. And almost last case, persistent delusional disorder. It is condition in which patient presents with a persistent single delusion or a set-related delusion. Main signs, clinical types, main signs. The duration must be more 3 months, before 3 months, we don't write this diagnosis, maybe wrong judgment. Absence organic pathology, exclude organic pathology, usually starts in the middle or late adult life, usually after maybe 40, 50 years. And absence typical symptoms characterized for schizophrenia. You must exclude, you remember the main signs of schizophrenia. Usually persistent delusional disorder, clinical types, usually we observe delusion of persecution, it is persecutory type, jealous type, grandiose type, erotomanic type, and somatic type. Usually it is a lot of cases of the main types, maybe in other types, but you must use previous criteria. And last slide, it is schizoaffective disorder. You remember the structure, it is last disorder in this group. It is very short information about this disorder because schizoaffective disorder includes 2 symptoms of 2 groups. It is symptoms of schizophrenia, you remember previous information, plus symptoms of affective disorders. Maybe mania, maybe depression. То есть if you see patients with symptoms of schizophrenia and mania symptoms, you must write manic stage, schizoaffective disorders. If person admitted by depression, we write depressive stage of schizoaffective disorders. Thank you, we finish, goodbye.